over the Christmas holiday, and then COVID hit, and we did Zoom after that.
Because it was just this past March that he got his?
He got his July 7th.
July.
2 weeks before his second birthday.
All right. Can I get you to say and spell your first and last name for me?
Andrea James, Andreajames.
Speak this way a little bit. All right. And whenever you're ready.
So start off, just tell me, when was the first time you ever learned about SMA?
Axel was 2 weeks old. My son was about 2 weeks old, and we were at Children's Hospital and kind of being evaluated by the neurologist team, and it was brought up that that was possibly what he might have. So we started looking it up, of course, Googling and stuff.
So for somebody who never heard of SMA, doesn't know, just explain what that is and what kind of effect it has on the baby.
Sorry, what did I say? Your hair is kind of covered off the mother.
You need my hair on the other side?
Yeah, if you don't mind.
Gotcha.
Perfect.
I can do it. Or here, I can just leave my hair back. Go ahead.
Reset that first one over again.
Okay, so kind of repeat that answer, when you first learned about SMA.
Look at me. So Axel was about 2 years old, 2.5 weeks old.
I'm sorry.
And Axel was 2.5 weeks old. We went to Children's Hospital to further evaluate his hypotonia. And the doctors immediately chose that as one of the blood works to pull. And so we started Googling it. That was our first, was Dr. Google. It was horrifying.
So explain that for someone who doesn't know what SMA is. What is it, and kind of how does it affect the child?
I will, broad terms, a lot of times it's considered the ALS for kids. It's something that I can quickly bring somebody to page. But basically it's a neuromuscular disorder. You slowly lose your functions, certain functions, important functions, to breathe, to eat, to swallow, to move your hands, arms, and whatnot. All kids are different, come out at different times. Some show floppiness at birth, some show at 2 months, 4 months, and on, depending what kind of type you are and how many backup genes you have. But it's the #1 genetic killer of infants. 1 to 2 years old is about what we're given. So that was about the most horrifying news.
So kind of walk us through your son's, from diagnosis to getting the treatment, kind of just as much of the abridged version you can give us. What was that process like?
Oh, quick version would have been, we were born, we got to Children's Hospital at 2.5 weeks old, had a few problems there and whatnot aside from SMA, but all in all, we started treatment right at 7 weeks old after we were diagnosed at 4.5 weeks. We started Spinraza, spinal taps, and got the loading doses, and then continued on with the maintenance doses until we had 8 total. His last dose was April 7th, 2019. And that whole time we were fighting for Zolgensma, I guess around August of 2019. He was right over a year old. And we fought for a whole year for Zolgensma. And that was a one and done, the difference is. So some Spinraza you'd have to take for life. You'd have to continue with spinal taps for the rest of your life. Spinraza we got 2 weeks before his second birthday. One of the best days of my life.
And so how has it helped him? I know it's only been it's 6 months. How has it been with that since then? How has it helped him? What have you seen in him since he's gotten?
Well, on the medical side, Spinraza is well out of his system. The half-life is long gone, so we're well out of that, and he's still showing progress. I thank Spinraza for that we were able to hold on to motor neurons and whatnot from 7 weeks old on, so that way Zolgensma was able to still take good effect. He's started sitting unassisted, a lot stronger, more confident. Grip, different things have shown increase in strength. He works with a PT twice a week and always getting good results there, showing high energy and whatnot. So
can you explain the Zolgensma, what it does, and just why that treatment works for these kind of patients? Yes,
there's 3 FDA-approved treatments. 2 of them work with the backup gene, and they have to be continued for life. This one is Zolgensma works with the immediate cause, the missing gene that causes our kids to have SMA. So it's basically a vector that carries the missing gene, and it passes the blood-brain barrier, and it disperses and attaches to the DNA. So it doesn't alter the DNA, but it's a gene replacement therapy. And so it is good. as far as we know, for life, but we will find out in the next 10 and 20 years, these kids that are dosed. We don't have anyone that's dosed, I don't think 10 years later yet. We will see.
So when you found out you were pregnant again, was that like, were you nervous about it? Like, how did that process go? Just walk me through when you were pregnant again.
Well, we went through and we did do an amnio since we knew we had a 1 in 4 chance of having another SMA child. When we got the news, it wasn't detrimental because Axel's quality of life is amazing and fun and full of it. And so it wasn't as scary this round 2. It was just advocating and getting on it and making sure we planned a good path for her. And it worked out really well doing the amnio because now we're at day 4, which is pretty amazing.
Yeah, and so let me just, that's my question, make sure I'm not missing anything. So this time around, like you said, it wasn't as scary. Maybe kind of expand on that, how this time it was different because you had the knowledge to get tested. You had the knowledge to get that information earlier. Just walk us through that.
Okay, well, when Axel was diagnosed, there was just one FDA-approved treatment, and it wasn't, a lot of doctors and everybody, still wasn't very common, or there wasn't a lot of proof out there that it was still gonna work and prevent these kids from having regression and whatnot. So I think when we found out with Lexa, we already had 2 FDA-approved treatments, but we had Zolgensma and the hopes for it, and we'd seen other kids do really well if given pre-symptomatic, and that's kind of the big thing with Zolgensma is the earlier you get it from birth, the better, and the more chances they have. So our outlook for Lexa is possibly walking, breathing on her own, swallowing, all the things that her brother, her hero, fought for her to be able to do. So they will have very possibly different outlooks and paths for life.
And so when did you find out that you were going to be able to get Zolgensma for Lexa?
Day 3. I got the news, I got the call that it had been ordered and it would be here today. And it was more than what I could have expected, more than what I could have hoped for. I think the women's NICU team, Dr. Holman, the neurologist, everybody, every piece to the puzzle, worked hard over the last 2 months. So it wasn't just a 3-day fight. It was well over 2 months ever since we got the news from the amnio. The Vexus team, Novartis, and yeah, it's been brilliant.
So I know you mentioned the team and Dr. Holman. What are the things, like how did they have to prepare? Like what are the things they had to do to make sure this was going to happen today?
Well, there's a lot of phone calls, a lot of criteria to find and get from the insurance company, and crisscross. There was a lot of training. The pharmacy had to be trained, the nurses had to be trained, people had to be trained for delivery. You know, it's a $2.1 million drug, so it's like carrying gold. Everybody that touches it has to be trained. So it took a lot of effort from everybody's parts, a lot of time it took, and patience, and people giving up their time to be prepared. So there was multiple people prepared for all other outcomes that could have happened if she would have came early and different things. So we had to go ahead and plan an induction, and yeah, and once she got here, it was basically just phone calls. We had to draw labs. We planned the induction in the OR, made sure that we were able to draw labs immediately. They got the blood taken and sent off the same day she was born, and I think that initiated the whole possibility of getting it at day 4. As far as I know, the earliest dose is 8 days old. Quite a few I know personally that are 10, but I don't know of anybody under 8. So she will now be the earliest dose, which is pretty phenomenal.
I was going to ask you about that. What is kind of after, especially after what you went through with Axel, talk about just how awesome that feels to be able to do it so early this time around.
I hope other moms, dads, family members understand that it can be done, that you fight for it. You go ahead and get the amnio done and start preparing, and it's more or less showing the possibilities for all these other kids. It's not just Lexa for sure, or Axel, and the fight is for spinal muscular atrophy. Let's find a cure, but till we find a cure, let's get all these kids the best quality of life we can, and that's early dosing. So it's basically fighting these insurance companies and making sure that they're on board prior to the kids being born.
And so you say this is not a cure. Mm-hmm. What do we know about SMA, and is there a cure that they're close to, or right now this is probably the most groundbreaking we're going to get for a little bit? What do you know about that?
This is as close to a cure. There's always ongoing clinical trials and other drugs. I'm not 100% knowledgeable on each and every one of them, only the ones that are out right now, the three main ones. But we always hope for a cure, and we definitely have come so far in the last 5 to 10 years as far as saving these babies' lives and giving them a quality of life. So I think we've come a really long way, and I think we will continue to fight for a cure, and inevitably it'll be there one day.
And so what are your kids' prognosis at this point? What are they expected to do, and what do you see kind of in their future?
With Axel, I think he has a chance to stand unassisted, to transfer and whatnot. He could possibly walk with assistance, but he's doing super well. I don't know if he'll ever gain his swallow back nor his smile, but I will leave that in God's hands and whatever. But his quality of life is wonderful. He's a happy child. He brings joy to anybody he meets. And then Lexa, it's limitless. I think it's possible that she hits every milestone that what would be considered a normal kid without a neuromuscular disorder would meet. So we'll cross our fingers and keep praying for her and fight, and PT and OT, keep her in therapies, give her the best chance she has.
Awesome. I guess the last thing is, what would you say to a new parent who just finds out for the first time about SMA, that their child has or may have it? What's your advice? What would you say to them?
Well, I think with any parent that hears the diagnosis is going to go to the computer and they're going to read about it. And I think the biggest thing is to not be so scared to get on Facebook or find the groups, find the community, find your SMA community, because it's a wonderful one and they're super supportive. And then just know that there is so much out there, and so there's treatment now. There's things that can give these kids so much of a more the word normal is just so hard to use, but such a more normal life.